Caring for cancer patients during the COVID-19 pandemic has proven to be a challenge. Clinical trials have been postponed, cancer screenings have been missed, and the uncertainty of whether a treatment will increase the coronavirus risk has left cancer patients in the dark. Ursula Perry has the questions you need to be asking to get the best care.
Nearly 2 million Americans will be diagnosed with cancer this year, and more than 600,000 will need chemotherapy. So what happens when you add COVID-19 to the mix?
Does getting chemotherapy a week ago, and then if you get this disease, is that going to be really bad?
Researchers from Vanderbilt University created a multinational database of COVID-19 patients who also had or have ongoing cancer to find out. They found cancer patients who contracted COVID-19 had a 16% death rate. But that number was not the same for all cancer patients.
If you get older patients, such as those over the age of 75, and especially those that have multiple comorbidities, we're seeing death rates over 50%.
While patients who did not have any other comorbidities besides cancer,
at least on our registry, there have been no deaths at all.
They also found people who had recent surgery or chemotherapy were not at an increased risk for contracting COVID-19.
It tells me as a treating oncologist that if patients need treatment for cancer, they need to get it.
So what questions must you ask doctors when considering the risks and the benefits of getting treatment?
What's the best thing that can happen? What's the worst thing that can happen? What are the potential benefits and risks? Is there anything to think about differently now versus 6 months ago? Can I delay the start of treatment safely?
Also, talk about whether you want resuscitation attempts or mechanical ventilation and who you would want to make decisions if you're unable to. Finding the answer to these questions would allow you for better care later.
Dr. Warner says an additional question you should ask yourself is whether you're comfortable going into intensive care or hospice care sooner than you might have had coronavirus not been around. Ursula Perry, KSAT 12 News.